Good evening, everyone, and welcome to Gut Microbiome and Your Health. My name is Claudia Zervini, and I'm a senior coordinator at HSS in the Community Education and Outreach Department. In today's webinar, we're going to talk about the gut microbiome and how it impacts your overall health. And I'm so pleased to introduce our guest today, Danna Raphael, who is a registered dietitian at HSS with over 10 years of medical nutrition therapy experience. She has worked with a diverse patient population in a variety of settings, including oncology, critical care, and liver transplant, as well as general nutrition care. And Dr. Caroline Andrew, who is the Director of Medical Weight Management at HSS. She is board certified in internal medicine and obesity medicine and board eligible in lifestyle medicine. Thank you, Dr. Andrew and Danna, for joining us. If you don't mind, could you just highlight your roles at HSS very briefly?
Sure, I can start. Thanks so much for having us tonight. So I'm a physician who specializes in obesity medicine. What is obesity medicine? It's a relatively new area of medicine that focuses on the multifactorial etiology of obesity. So obesity is very complex, weight gain is very complex. We used to think that, it was as simple as telling someone, eat less, move more, they can lose weight. We now know there's much more to it. There are genetic factors, hormonal, biologic. Your weight can be affected by stress, by sleep. The microbiome, as we'll discuss tonight, can definitely play a role. So I'm really excited to be here to talk more about it.
And I'm one of the inpatient dietitians. So I see patients who have had surgery and just help them make sure that they are meeting their nutrition needs while they're in recovery. And then in addition to that, I also cover the ALS clinic at HSS.
Fantastic. We're so lucky to have you both here at the hospital. So first, very general question, and I think Dr. Andrew, this is a good one for you. What is the human gut microbiome and what type of organisms make it up?
So the gut microbiome is, there are trillions of microorganisms that live on our bodies, in our bodies. Most of them reside in the gastrointestinal tract, the gut. It's bacteria, viruses, fungi, protozoa. And, we're still actually learning all of the different types there are. We don't know all of them yet. There's so many. But, the microbiome has become a very sort of hot area of research because it's been associated with certain chronic diseases, health conditions. But that's essentially what it is. A lot of these microorganisms living in our bodies.
Danna, I think you had a fun fact that if you took out all of the microorganisms, it would be about 7 pounds.
I can't remember the exact number, but it was something really crazy, like 5 or 7 pounds of your body weight is from the trillions of bacteria that's in your gut.
Yeah, I've seen 5 pounds, definitely.
Yeah, I think 7 was a little excessive, but something like 5 pounds. It's a lot.
Yeah.
5 pounds definitely still feels like a lot. Wow, that's fascinating. So with that, is each person's microbiome unique, or do we all have the same? And if they are unique, what kind of factors form the microbiome and affect it?
So everyone's microbiome is unique. It starts to develop in utero and with birth, in the birth canal, or from a C-section. There's some development there. And then early in life, whether the infant is fed breast milk or formula, it continues to develop. Most of the microbiome is developed by around age 3. However, it continues to change throughout our lives, and things that can affect it are infections, a gastroenteritis, a colitis, maybe if you take antibiotics or other medications that can affect the microbiome. And diet is a huge factor as well. So again, much is developed very early in life, but it continues to change throughout our lives.
So interesting. I didn't realize that depending on how a baby is born, that can affect their microbiome and the bacteria that they're exposed to. Wow. And so how does this affect our healthcare? Why should we care about the microbiome?
So the way the microbiome works is, and we're still learning about this, but what we know is that when it's in balance, when there are a lot of different bacteria living together, kind of getting along, I guess, things are good. And when there's a lot of diversity in your microbiome, so lots of different types of bacteria, that is typically associated with a healthier state of being. When we, for example, if you take an antibiotic, that can disrupt that balance. And so certain strains are going to dominate. And that can sometimes bring up issues, GI issues like diarrhea or infection of the colon or the GI tract. So again, it's really all about that balance. And that's what we are learning more about. But we're seeing that when certain strains of bacteria dominate, that can be associated with health conditions like obesity or type 2 diabetes or autoimmune conditions. And that's really what we need to continue to look into, because there may be potential for treatment options for these conditions utilizing the microbiome.
Wonderful. And I think we actually have a slide on some of the different conditions that are affected or could be potentially affected by the microbiome. And Dr. Andrew, could you just clarify, it's not necessarily causation here, but we are seeing a correlation?
Definitely want to be clear about that. And we're still, again, learning about the microbiome, and so far, we really don't see any causation. It's just that there's a correlation between a certain composition, let's say, of the microbiome and some health conditions.
Great. And so in terms of the relationship between gut health and overall health, here we have this image. Dr. Andrew, could you mind walking us through some of these conditions?
So we're seeing that some kind of dysbiosis, or when that balance of bacteria, I'm saying bacteria because that's most of the microbiome, when that bacteria balance is off, we can see an association with these conditions that are on the slide. And there are more than what's on the slide, but this highlights some of them. So we're even seeing that depression or some psychiatric conditions can be associated with microbiome dysbiosis. Inflammatory bowel disease, IBD or IBS, and then, as I said, type 2 diabetes, obesity, insulin resistance, metabolic syndrome, food allergies, autoimmune conditions like rheumatoid arthritis or psoriatic arthritis. These are all areas that have been associated with microbiome dysbiosis.
Wow, this is definitely a lot of conditions. And just from my own preliminary research, it does appear that there's a lot more and a lot of research going on into how the microbiome affects these conditions or impacts our health and may affect these conditions. So in terms of musculoskeletal health, which we're always interested here, being an orthopedics hospital, does gut health play any specific role in musculoskeletal health outcomes?
Gut health does play a role, and we're learning more and more about how exactly, but a few ideas. So the microbiome actually helps us digest our food. And when we eat certain foods and fibers, the bacteria ferments. There's a fermentation process that goes on, and something called short chain fatty acids are produced. And this is a substance or a molecule that has anti-inflammatory properties. So there is an anti-inflammatory component to gut health that may be linked with autoimmune conditions. Some studies have shown that, again, the microbiome dysbiosis is associated with rheumatoid arthritis, may be related to someone's prognosis with RA or how well they respond to certain medications. The disease-modifying anti-rheumatic drugs have been shown to also affect the microbiome and may potentially bring back some of that balance in the microbiome, which can be beneficial for the body, for inflammation. So there's definitely something there. And we're, down the line, there may be treatments that are related to microbiome or gut health that actually can help someone with RA or another autoimmune condition.
That's great. And I guess just nutrition in general can affect our musculoskeletal health outcomes and how we're able to maybe exercise better or fuel our bodies. Danna, do you mind touching on that briefly?
Good nutrition is important for your body to function, and that also goes for your muscles and your bones. So, just some key foods to focus on are, getting protein in, focusing on the leaner proteins like beans and legumes, nuts, seeds, fatty fish like salmon and mackerel and sardines. These fish are higher in omega-3 fatty acids, which are anti-inflammatory, calcium, which helps to build strong bones, and vitamin D that helps your body absorb the calcium. So, calcium can be found in foods like dairy and leafy green vegetables, bony fish, tofu, nuts, almonds and walnuts. And then vitamin D is found in fatty fish like the tuna and the mackerel, mushrooms, egg yolks, and fortified foods like milk and cereal. And I think just, general recommendation is to aim for like an overall healthy diet, something close to the Mediterranean diet, which is high in fruits and vegetables, the nuts, the whole grains, the fish, and the healthy oils.
All great recommendations, and I'm getting hungry as you speak. Dr. Andrew, are there any specific bacteria that are harmful or helpful to our gut health? And if so, how would they positively or negatively affect us?
So again, it's all about that balance. So for example, there's a bacteria called Clostridium difficile, and C. diff for short, we call it. And it normally lives in our guts, and it only becomes an issue when someone takes an antibiotic, a really strong antibiotic, for a prolonged period of time. And that can wipe out certain strains, and it allows that C. diff to grow and kind of take over and cause issues. So that's an example of a bacteria where it's really not an issue just on its own, kind of living with all the other bacteria, but then when it takes over, it's a problem. There's another bacteria called Akkermansia, which has gotten a lot of attention because it's been inversely associated with obesity, and insulin resistance or type 2 diabetes. So people with a lot of it in their microbiome, it's found to be preventative for obesity and type 2 diabetes. But we're not at the point yet where we can tell someone, oh, just take a probiotic with Akkermansia in it and it will help you lose weight or treat your diabetes. It's just, unfortunately, it's just not that simple. So we have a long way to go before we're at that point. It's really about the balance of bacteria. And the most researched, from my experience, the most researched bacteria you'll see Saccharomyces, Bifidobacterium, and Lactobacillus. Those are pretty common when you buy a probiotic like at the drugstore, order it online, you'll probably see those in there. I think it's important to talk to your doctor. We may talk more about probiotics. I know we're going to get to that. But if you are considering taking a probiotic to treat something, talk to your doctor, because there are resources available. Your doctor can actually look into what's been researched for specific health conditions. So if you have Crohn's disease, for example, your doctor could look up and see, okay, what strains have been studied, what's been found, and should we, which one should we try?
Great. It actually lists lactobacilli on my yogurt. So but it's
Yeah, and yogurt is a great source of probiotics. So I'm sure Danna will talk a little about that too.
definitely. So along with that, what are some signs maybe that your microbiome might be off balance or there's something going on?
You may have some GI symptoms like bloating or constipation, diarrhea, abdominal cramping. Those are definitely signs that something's going on in the GI tract. And it could be related to your digestion, the microbiome, but, it may not be obvious. I think going back to that slide we showed, if you have a chronic condition, the microbiome may be playing a small role, but it may not be that you're having specific GI symptoms. So again, bring it up with your doctor and discuss if it's something worth looking into further.
Great, thank you. So Danna, how can one improve their gut health and promote a healthy microbiome?
So, there's a few ways that we can do this, and eating a variety of foods is I think the best one. A diet that's consisting of different types of foods can lead to a more diverse microbiome. Focusing on fiber, which Dr. Andrew had touched on, like the short chain carbohydrates and fatty acids are in things like fruits and vegetables, legumes, beans. The dietary fiber can only be broken down and fermented by enzymes from the microbiota living in the colon. And the fiber promotes the growth of beneficial gut bacteria, which includes specific types of such as like bifidobacteria, which is one of the ones that has been identified as being a good one to have in your gut. Eating fermented foods. So fermentation is a process in which the sugars are broken down by yeast or bacteria that are rich in the lactobacilli, a type of bacteria that's beneficial. And I think, as you guys were saying, most people are familiar with the lactobacilli being in yogurt. And some other foods that contain lactobacilli are kefir, which is kind of like a liquidy yogurt drink, kimchi, sauerkraut, kombucha, and tempeh. Eating more whole grains. The whole grains contain those non-digestible fibers, which make their way to the large intestine and promote the growth of the beneficial bacteria in the gut. Eating a more plant-based diet. So the fruits, vegetables, beans, whole grains, again, are loaded with the fiber that are most beneficial in creating a diverse and healthy gut.
These are all great recommendations. And Danna, just a quick question. Are all fermented foods like the same quality? I love pickles. Are they going to have the same advantageous effects as kefir might?
Yes. It'll have a different effect. You have to be sure that it's more, I don't think like the Vlastik pickles that you get in the canned aisle are going to have the same effect than if you get one that's fresh that has to be refrigerated. And same thing with the sauerkraut. You will get benefits from the sauerkraut that is in the can, but you get the most beneficial fermentation bacteria from the one that's in the refrigerated section.
That makes sense, focusing on more whole, fresh foods. Absolutely. So I do see a few people are asking about this, so I'm excited to address it. What is the difference between probiotics and prebiotics, and what are your thoughts on supplements here?
So prebiotics are types of fiber that are found in the fruits and the vegetables and legumes. Humans are not able to digest these fibers in the stomach or the small intestine. They move down to the large intestine where they act like food for the healthy bacteria to feed on and grow. Foods that are high in prebiotics include all types of beans, peas, oats, bananas, berries, Jerusalem artichokes, which are also known as sunchokes, asparagus, garlic, onions, and leeks. The prebiotic fiber is turned into the short chain fatty acid, one of which is called butyrate, And butyrate is one of the bacteria that has been identified to be beneficial in the gut. Its benefits range from maintaining the integrity of the intestinal barrier, mucus production, and protection against inflammation in the gut. So switching to probiotics, those are live microorganisms that provide specific health benefits when consumed. The probiotics don't permanently colonize the intestines in most cases, but they may benefit your health by changing the composition of the microbiome. And as Dr. Andrew was discussing before, there are some benefits that probiotics can help when the gut has been altered after taking antibiotics, or if you had some kind of gastroenteritis symptoms like diarrhea. So taking a probiotic, then the studies have been shown that is beneficial, whereas a general healthy person may not see a consistent benefit to it. And something else to note is that everyone metabolizes the probiotics differently, so not everyone will experience the same benefits from taking the same strain. So you can increase your intake of probiotics by consuming more probiotic-rich foods like the fermented foods, kimchi, kefir, sauerkraut, yogurt, and you can consider taking a probiotic supplement. But to echo Dr. Andrew, definitely talk to your doctor before starting the supplementation, especially if you are taking other medications or have some kind of underlying health condition. I don't know. So I also wanted to touch on two other like buzzy words that we've been hearing a lot recently, which are symbiotics and postbiotics. The symbiotics are a mixture of the pre and probiotics. And the idea behind the symbiotics is that the prebiotics help the probiotics survive in your intestines. The prebiotics is kind of like the food for the probiotics to help grow. Though there's some lab studies that indicate that symbiotics may offer benefits, but more research is needed into how they will actually affect the human body. And then postbiotics are bioactive compounds made when healthy bacteria in your gut feed on various types of prebiotic foods in your colon, like fibers. Postbiotics have been linked to various health benefits, such as aiding in immunity, preventing or treating diarrhea, reducing symptoms of irritable bowel diseases, reducing the severity of certain allergies, aiding in weight loss, but research is still in its infancy, so its uses aren't widely recommended yet.
So interesting. So are symbiotics and postbiotics available like the probiotic supplements you might find, or are they a little more difficult to find?
They're not really widely available in stores. I think you might be able to find them in some stores or online, but because we're not really sure of the full benefit yet, doctors, dietitians are not recommending them just for standard consumption for consumers just yet.
Makes sense. And so in terms of, I do see some questions about taking probiotics. So do you have any recommendations if someone did want to incorporate a probiotic supplement into their diet?
I would say start with food first. If some people will benefit from taking a probiotic. I would talk to your doctor about which one they would recommend based on what you're trying to achieve. So if you're having some GI issues, either diarrhea or constipation, there might be some kind of blend that is, better recommended for that.
Great. And speaking of food and food first, what are some foods that you can incorporate into the diet to help promote good bacteria? And are there any foods that should be avoided?
So there are a number of studies that have been showing that vegetarian diets benefit the gut microbiome, which is probably due to their high fiber content. But it's unclear if the benefits of the vegetarian diet on the microbiome are due to a decrease of meat intake or if there are other factors that may play a role. I think the biggest takeaway is to just focus on fruits and vegetables, whole grains, legumes, fermented foods, eat meat in moderation. Eating should still be pleasurable. So I don't think it's beneficial to say avoid certain things. It's unreasonable to say don't have the cookie, don't have the cake, don't have the ice cream. And moderation is key. And just limit the processed and the packaged foods.
I appreciate that so much. And, by avoiding foods, it's possible you could even throw off your microbiome by stressing yourself out, maybe. I don't know if there's science behind that, but I like to think so. When should you seek support from a nutritionist or a specialist, and how might they be able to help?
So it's important to see a dietitian to help manage chronic diseases like heart disease, diabetes, kidney disease, if you have cancer. But there are other reasons to meet with a dietitian. If you're struggling to find a way of eating that's sustainable to follow long term, if you're either always hungry or too full, if your relationship with food and your body needs to be repaired. And an example of this would be if you're always feeling guilty about what you ate, or if you feel the need to compensate for eating certain foods or amounts of foods by not eating afterwards. If you want to improve your athletic performance, if you want help managing your weight, you could benefit from working on behavior changes. If you need help with meal planning, basically everyone can benefit from seeing a dietitian.
Absolutely. Those are all great reasons. And so both of you, Danna and Dr. Andrew, have talked about and alluded to some of the ongoing research that's going on about the microbiome. So is there anything, that's being researched, or any preliminary research that you both are particularly excited about?
I think, I'm excited about the whole field is very exciting, because I think we're learning more and more about how food actually is medicine. And I know Danna's excited about that too. It's just, we can do so much with nutrition, and we're actually seeing that, with the microbiome and the direct effects that a certain diet can have, and how that affects our health and can affect the development of certain diseases, or the prevention of certain diseases. I think also recently it's been interesting. There's been some research about the connection between the gut and the brain, and mood, depression. And that's I find that area of research very interesting. That nutrition could actually be used to help manage depression, not as the only treatment, but as a way to supplement. And so, yeah, it's all really exciting, and I'm looking forward to seeing what comes up over the next few months, years related to gut health.
Yeah, I agree. I think, the entire microbiome is fascinating, and I'm just really excited to see what's uncovered in the next handful of years on how, diet can affect the body, and how we really can use food as medicine.
Great. Thank you so much for all of this incredibly valuable information. We're going to turn now to some of the audience questions. I'm just scanning here, and there's a lot of good ones. So first, I think this was listed on the slide with some of the conditions. Dr. Andrew, how would you define, or what is metabolic syndrome?
Metabolic syndrome is a set of criteria related to your blood pressure, cholesterol, your glucose or blood sugar. Sometimes it factors in measurements like waist circumference. It's a way to assess your metabolic risk or cardiometabolic risk. So risk of developing diabetes, heart disease. So there are a few different factors that go into it. And that's something that can be tested for, with your doctor. You could ask your doctor about it if you think you might be at risk for that kind of thing.
Great, thank you. And another disease-specific question, are you aware of any role that the microbiome might play in axial spondyloarthritis or ankylosing spondylitis?
I'm not aware of any specific studies, but I wouldn't be surprised if there were studies out there and there were some kind of association with the autoimmune conditions. There's a clear connection there. And sorry, can you repeat the conditions again, Claudia? Actually,
Yep.
It was
Axial spondyloarthritis and
okay.
Ankylosing spondylitis.
Okay, thank you. So yeah, with autoimmune conditions, there's definitely a connection. And even if I can't name, specific studies, I know there's something there, and there probably will be studies looking at that in the not too distant future.
Great. This is a great question. How do you evaluate or assess someone's microbiome?
That's a really good question. So the most common, or the approach that's used, is actually taking a stool sample and sending it to a lab, and then they can put together a composition. And like I mentioned in the beginning, we actually still don't know a lot of the organisms that live in our microbiome. So we're not able to tell someone all of the organisms, but we can say what some of them are. And but a stool sample sent to the lab. And there are some companies that are now offering home tests, and you can, send in a sample from home and they'll send you information. And I would just say, maybe again, talk to a dietitian or a doctor before you do one of those. There's a lot of stuff out there, and we just don't know how valid certain tests are yet for the microbiome.
Absolutely. Does the use of antibiotics permanently change or even destroy your microbiome, and can it be reversed?
So my understanding is that the use of antibiotics can sort of transiently change the microbiome. I don't think that there are permanent effects. The microbiome does change throughout our lives, and there are always different factors affecting it. So diet being a major factor, even if antibiotics do affect, I wouldn't say they destroy the microbiome. I would say they disrupt it a little bit, throw off that balance. And a diet, following a certain diet, could actually probably bring back that balance. So I wouldn't worry about it there being permanent damage when taking an antibiotic.
Absolutely. And that's important, because I would imagine that the risk of not taking an antibiotic when you need one could be greater than the risk of affecting your microbiome.
Exactly.
And I think it's usually
really
recommended.
Important.
Sorry.
Go ahead. No, that's really important. Definitely, you want to take the antibiotics when it's recommended. Yeah.
And I think it's generally recommended to take a probiotic either while you're taking an antibiotic or afterwards, to help repopulate some of the bacteria that has been lost with the antibiotic.
Another testing question. So is there progress in creating tests that can determine the bacteria that are causing specific conditions? If so, is research progressing in finding medicines, so treatment? This might actually be where a nice, the C. diff example with fecal transplants.
Yeah, that's a good point. So there are some, I guess, to kind of back up there, the testing is something that is still in early stages, and I think will get better over time. Like I said, there are some companies that offer home tests now. We don't really know how valid those are, but there are bacteria that we know we can test for, like C. diff, and which we know can cause problems. And the treatment, one of the treatments for refractory C. diff is actually something called fecal transplant. So essentially, someone who hasn't responded to other treatments, which involve antibiotics, and it's a whole other talk, but basically you take a stool sample from a healthy person with a healthy gut and implant that into the person who has C. diff, and it works really well for treatment. And basically you colonize the person with C. diff with a new microbiome, a new balance of bacteria, and it helps improve their symptoms and treat the infection. So that may be, and I know they're looking at fecal transplant as a treatment for other conditions. So irritable bowel syndrome, inflammatory bowel disease, and then it's even being looked at for obesity, and I'm sure other conditions as well, but we haven't gotten to a point where we can use it yet for those conditions.
Absolutely. A lot of these questions are similar in people wondering, how do you test your microbiome again? And, are there specific, do we have a specific link to certain diseases or propensity? And it's just unfortunately not quite there yet.
Yeah, that's true.
Okay, let's see. Danna, what about the idea of whole grains and leaky gut? And does leaky gut, is that associated with an imbalance in the microbiome perhaps?
Yeah, I mean, the leaky gut is associated with an imbalance in the microbiota. I don't think you can definitively say that whole grains are a cause of this. Everyone's microbiome is different, and some people it can affect it and can cause some GI issues, whereas other people are able to tolerate them fine. Everyone's microbiome is different, and it's really hard to give just general recommendations. Like a lot of people say, avoid the gluten, avoid the dairy, but that may not be helpful for some people.
Great. And speaking of avoiding foods, someone commented that regarding fermented foods, they get reflux when eating anything too spicy or acidic. So what is likely to be the least possibly aggravating fermented foods?
Probably the kefir. I think that's the most mild. And yogurt is typically tolerated pretty well. It is a little acidic, so maybe not eating it on an empty stomach, and having something a little bit beforehand would help with that.
Great. How does drinking alcohol affect the microbiome?
I mean, so we know alcohol is inflammatory, and so I mean, I don't know if there's been studies. I'm sure there have been, but I imagine that it's not beneficial for the microbiome. I don't know if Dr. Andrew, if you've seen anything.
I'm thinking I'm not sure of the direct effects on the microbiome, but alcohol is a toxin and is definitely an inflammatory substance. So it can be good for the microbiome. I don't know if there are direct detrimental effects on it, but probably not going to improve the gut health. I wouldn't use it for that, or think of it as doing that.
Great. Speaking of mental health, Dr. Andrew, are you aware of any studies done on the relationship between ADHD or autism and the microbiome? I know this isn't exactly in your day-to-day clinical care, but
I did come across some studies looking at autism, but I can't really report the results of that here. I think one of the themes of the talk tonight is just that the microbiome is associated with so many conditions, and I wouldn't be surprised if there is literature out there about ADHD and autism. I've definitely seen. So if you're interested in that, worth looking into it. again, talk to a doctor or a health professional and see if, who specializes in that area, and they may know more and be able to give you actually specific studies to read and look through.
That's great. And there are a few other questions that are asking about specific conditions and their relation. So I would just reiterate the same response, it seems.
Yeah, there probably is some association, and so worth looking into it more and asking whatever medical specialist you see about that condition.
Great. Well, that's about all that time that we have this evening. I want to thank everyone for joining us tonight, in addition to our wonderful panelists for all of this fantastic information. I've certainly learned a lot, and I'm excited now to see how the research progresses in terms of how the microbiome affects our health.